The majority of cancers are contained, at least in the beginning, to a specific area. But imagine having cancer throughout your entire body. I'm Catherine. Welcome to the Inspired Vitality Show. Today, I honor Blood Cancer Awareness Month and World Lymphoma Day, which falls on September 15. There are three major types of blood cancer: leukemia, myeloma, and lymphoma. These cancers cause your bone marrow and lymphatic system to make blood cells that don't work as well as they should. They all affect different types of blood cells, and they act in different ways. Leukemia and lymphoma are cancers that affect the blood or bone marrow and are the most common cancer in children younger than 15 years. Let's dive deeper into leukemia first. Leukemia starts in the tissue that forms blood. Most blood cells develop from cells in the bone marrow called stem cells. In a person with leukemia, the bone marrow makes abnormal white cells called leukemia cells. They may crowd out normal white blood cells, red blood cells, and platelets. This makes it hard for normal blood cells to do their work. There are four major types of leukemia. Be patient with me as I try to say them. There is acute myeloid leukemia, also known as AML, and this affects the myeloid cells and grows quickly. Then there is chronic lymphocytic leukemia, which is CLL, and this affects lymphoid cells and grows slowly. Then there's acute lymphoblastic leukemia, which affects lymphoid cells and grows quickly, known as ALL. Last, there's chronic myeloid leukemia, or CML, which affects myeloid cells and grows slowly at first. AML and CLL are the most common types in adults. ALL is the most common type in children. Multiple myeloma is a blood cancer specifically of the plasma cells. This is a cancer of the plasma cells in bone marrow. The plasma cells are a type of white blood cell that makes antibodies. Myeloma cells spread throughout the bone marrow. They can damage your bones and crowd out healthy blood cells. These cells also make antibodies that can't fight off infections. This cancer is often called multiple myeloma because it's found in many parts of your bone marrow. I have a specific video about multiple myeloma that I made earlier, and I'm going to link to that video in the video description. Now moving on to World Lymphoma Awareness Day, which is held on September 15 every year and is a global initiative hosted by the Lymphoma Coalition. It's a day dedicated to raising awareness of lymphoma, the most common type of blood cancer. Lymphoma begins in cells of the lymph system, which is part of the immune system. Lymph tissue is found throughout the body, therefore lymphoma can begin almost anywhere. There are two basic categories of lymphomas. There's the Hodgkin lymphoma and non-Hodgkin lymphoma. Non-Hodgkin lymphoma includes a large, diverse group of cancers of the immune system cells. Scientists typically categorize them as either slow-growing or aggressive. Lymphoma can grow in many parts of the body, including the lymph nodes, spleen, bone marrow, and other organs. Both Hodgkin and non-Hodgkin lymphomas can occur in children and adults. Symptoms of lymphoma can include fever, fatigue, swollen glands. It's often similar to less serious diseases like the flu, and this can lead to patients sometimes getting diagnosed late. World Lymphoma Day can raise awareness about lymphoma and the particular emotional and psychosocial challenges facing patients and caregivers suffering from different forms of lymphoma. While patients with low-grade lymphoma often react positively to treatment, the cancer is characterized by cycles of remission and relapse. Lymphoma is characterized by fatigue, and this is made even more so acute with treatment, not only chemotherapy, but also targeted medication and other new drugs that have increased survival rates, but that also cause fatigue. Patients indicate fatigue has the biggest impact on their well-being overall. Blood cancer advocates aim to ensure that lymphoma patients' organizations have the right information so that patients can make informed decisions about their treatment, their lifestyle, and other aspects of living with cancer that may not be immediately addressed by the medical community. Helping the medical community understand the patient experience, including fatigue and the fear of relapse, is a key message. I hope this video has given you a better understanding of the three major types of blood cancer: leukemia, myeloma, and lymphoma. Blood cancer has touched my family personally, and I'm wondering, has it for you too? Or is this information new? Let me know in the comments. I'm going to link to some great resources in the video description. I'll see you soon.